Program Manager at Realize in Canada. We had to skip over this brief introduction to HIV and aging in Canada during the iCOPe HIV webinar on Friday, the 27th of January. So I'm recording this after the fact as a supplement to the main webinar video recording. In response to the question, what does it mean to age with HIV in Canada? I don't want to repeat all of the important experiences raised by other presenters in the webinar. Many of these are routinely raised by older people living with HIV in Canada too, including comorbidities, ageism in sexual health care, HIV stigma, and disability. I'm going to base my responses on policy and systems level issues. First, it's impossible to generalize the experience of what it means to age with HIV in Canada. The country is vast, so different regions have different geographic landscapes, settlement patterns, languages spoken, and even weather. Each of our 13 provinces and territories has its own government, which makes decisions about policy. The demographic characteristics of people living with HIV in different parts of the country varies, as do predominant modes of transmission. All of this variability impacts access to services. The second issue I want to address is the use of language and definitions. There's a lot of ambiguity, so it isn't always clear who is aging with HIV, depending on who you ask: researchers, clinicians, policymakers, people living with HIV. A recent pan-Canadian research agenda on HIV, aging, and older adulthood, prepared by Realize and partners from the National Coordinating Committee on HIV and Aging, stresses the importance of differentiating between the needs of people who are aging with HIV, who could be people born with HIV, or middle-aged people who are thinking ahead about aging-related issues, and people who are living with HIV who are already elderly or over the age of 65. We're calling on people to be more explicit about whether their research or response addresses aging or long-term survivorship. While many people fit into both groups, others don't. What's obvious through research and anecdotes is that many older people living with HIV in Canada demonstrate a great deal of resilience, especially long-term survivors who've honed skills and strategies for dealing with various hardships. Many older people are keen to give back to the community as mentors, volunteers, and decision makers in the HIV response. Finally, a shared experience among many older people with HIV in Canada is that there's a great deal of uncertainty, whether about the availability of practical in-home or caregiving support as one gets older, financial security, or what to expect physically, mentally, or cognitively as one ages with HIV. Again, with respect to key issues, I'm going to focus not at the individual level, but at the broader level. Since each of Canada's 13 provinces and territories has its own government, which is responsible for healthcare, social services, and epidemiological monitoring, it can be extremely difficult for us to get a complete picture of how many people are aging with HIV in Canada. The data is piecemeal. While some provinces are now publishing epi data on HIV prevalence by age group, and a few are even disaggregating it into 10-year age cohorts beyond the age of 50, others aren't. We don't have national level HIV prevalence estimates by age group. Furthermore, supports and services that are available in one jurisdiction might not be available in another, despite our national universal healthcare system. Along those same lines, having access to free hospital and primary care is something many of us in Canada value dearly, but our healthcare is certainly not universal in the sense that it doesn't include coverage for prescription medications, vision, hearing, and dental care, mental health supports, and community-based rehabilitation services like physiotherapy. Many of these services are integral to helping older people with HIV maintain their quality of life. A recent project conducted in Ontario showed that because of inequitable policies and disability across the life course, low income, food and housing insecurity, and forced reliance on government benefits were common among older people with HIV, especially those living with HIV long term. Finally, intersecting forms of stigma, both interpersonal and systemic, including HIV-related stigma and ageism, as well as racism, homophobia, transphobia, and ableism, also limit access to support for many older people living with HIV in Canada. Initiatives in place to address these issues in Canada are many. My organization, Realize, provides national leadership in the area of HIV and aging, acting as the secretariat for the National Coordinating Committee on HIV and Aging. A national assessment of the self-reported needs and care preferences of people living with HIV age 60 and older is about to begin in April. That study is called Panache. And several clinical research projects are studying various health outcomes for older people living with HIV, including cardiovascular disease, cognitive health, and correlates of healthy aging. Realize is conducting a situational analysis of ageism in Canada's HIV, hepatitis C, and STBBI response in order to inform policy change and encourage interministerial relationship building between decision makers in the aging and public health sectors. We also provide training on demand for pre-entry to practice healthcare professionals and staff working in settings serving aging persons to increase their capacity to provide high-quality, stigma-free care for people aging with HIV. But unfortunately, this training has not yet been incorporated as a standard requirement for all learners and providers. Integrated geriatric and HIV clinics are few and far between, but there are several good examples, including the CHI service at McGill University Health Centre and the Oak Tree Clinic for Women in Vancouver, British Columbia. Peer support groups for older people living with HIV are offered by some community-based organizations too, but not all. There are a lot of good initiatives being put in place, but there's still a lot more to do here in Canada on HIV and aging. Thank you.